It's 11:41, and this event has already been a lightning rod of purpose and resonance. It's just incredible to be here.
Good morning, bonjour, happy Tuesday, and most importantly, welcome. We are just thrilled that each and every one of you have journeyed from various parts of the country where you call home to be with us for the next day and a half. So we're going to embark on a different kind of journey today, really exploring some phenomenal projects and some really incredible interventions within the field of mental health promotion.
Hi, I am so thrilled to be here celebrating after 2 years of hard work and grit and challenges and big successes. Health promotion is the process of helping ourselves and one another to gain more control over our health and the conditions for our health and well-being, right? Shifting power to people to decide for themselves what matters to them, right? And to start with what's strong over what's wrong.
Coming here, I didn't expect to meet all the amazing people that we've met.
It's just been such an incredible experience getting to learn so much about, the possibilities of and opportunities available to all of our communities.
Really good to connect with people nationally and know that this is not a Toronto issue, but this is a Canada-wide issue, if not an international issue.
The openness of the discussions in this conference are really incredible. Working with various partners, working with people that maybe we didn't think about working with.
I felt both seen as a worker in the sector and heard.
Communities who face barriers to accessing health and health services, barriers to equitable access to the social and structural determinants of health are often ignored. Not in this room, but in many rooms, in most rooms. And the work we do is so vital. And one of the most significant ways to make this work sustainable, and I mean financially sustainable, ecologically sustainable, emotionally and mental health-wise sustainable, like can we keep this up? We have to make it part of the regular system so we can rely on it. But one of the most important ways to do that is to share our story and to share it together, because there is a perception, in some ways reflected by the current reality, that community health work is a series of pinpoints all over the place that don't add up to something more than the sum of their parts. And we're here to challenge that and to find the ways in which we do add up to more than the sum of our parts.
The panelists speaking about youth engagement, speaking about doing things differently and with a lot of bravery is something that I saw up there.
And initially the panel was called What Works? And in reaching out to our panelists, one responded and said, I don't know what works for everybody. I don't even know what works for all people in this community, let alone folks across Canada. And we said, wow, that's a really good point. Yeah, the title that we've come to is much more relevant to the conversation we'll be having today, which is Journeying Together, a Collective Learning Panel.
Woo, okay, there's so much to say. So in the last 3 years, we've grown from a team of 2 to a team of 21 people, and that has expanded our capacity to take care of one another in a way that wasn't available to us before. We also desperately needed that staff because we had an incredibly ambitious goal of training 19,000 Métis individuals in 3 different lengths of suicide prevention training.
The results I've heard today are just mind-blowing. I can't wait to see what that picture looks like.
I feel like in this moment we're all facing the same direction. So it's inevitable that the change we wish to see is going to come about.
The longer I work in this field, the more complex the field gets, but also the solutions seem easier and easier to me, but also difficult to land on because it's about changing culture.
Talking about topics around mental health or gender-based violence, all of these things resonate with great work that actually is happening on the ground and what we can learn from it. So that is one of the major takeaways for me, is just the reinforcement in other sectors that this is where we need to focus our attention.
Not being afraid of not following the normal pattern and trying different things.
A lot of our work has really been in meeting with community partners who know that part of the work better than we do. So people who have that lived experience, who have frontline experience. And so coming from an academic institution, that's a bit of a shift from the way that things have historically been done.
It's necessary. It's necessary to sometimes do therapy in a moving van.
It's connecting from your own personal experiences to be like, hey, I've been there. This is what I did. Kind of here's what I can give you to kind of move forward in that way.
That co-creation process I really felt like has grown our project in ways that I think will be very impactful long term.
It's not that there's a secret sauce. It's not mystifying mental health or well-being. It's about belonging, meaning, purpose, having a place, having a role in your life. Like, it really isn't all that complicated.
Relationship, relationship, relationship. Like, and if you're ever at a crossroads where you don't know what to do, default to relationship.
Culture and community is mental health.
Cultural engagement without inclusion leads to tokenism. And I see a lot of head nodding, so I know this is something we all know cellularly. Mental health is relational. It's a relation to our identity, it's a relation to our community, to our resources, to our sense of self, to one another. So therefore, the response to this current epidemic of social isolation and loneliness, that is very much our new post-pandemic reality, will be addressed by an investment in our relational resources and richness.
How can we collaborate so that we can continue some of the pieces of the work, if not all of the work?
How can we, as a team, like we said, how can we help each other?
How do we take this as a window of opportunity to try to embed a focus on resilience planning?
In my 33 years of working in nonprofit, small scale, large scale, all between the in-between scale, I have never known this level of investment in community health ever. Like, this is extraordinary. The things that you have and this learning and this richness, if we could just gather all of that data, we could go to government with both the problem and the solution and the proof all in one. We are stronger together, not in a fight, but in an invitation for collaboration. It's very hard for government to work with 40 different projects. It's much easier to work with cohesive ideas. You are the gap fillers. You're the space holders between where we are in this society now and where we want to be, what that society looks like. And that ability to hold that space is extraordinarily difficult, and it requires incredible courage.
Statistics and metrics give us evidence, but the stories, the qualitative data, tells us why the funding mattered, the true impact of this investment. Together, we can build a more accessible, compassionate, supportive, and resilient mental health landscape for all Canadians. Thank you. Merci.
Way ya, hey ya, hey, hi ya, way ya, hey ya, hey yo, way ya, hey ya, hey ha, way ya, hey ya, ho, hey, hi ya, ho, hey. Way hi yo, way hi ya, hey ya, ho hey.